Hi everyone, this is Steve Field from the Prime Safety Department. Today I'm downstairs in the lower level of the Millennium Building, and this is where Trinity Health and Cardinal Sleep are both located. We're very fortunate to have such a fine facility down here. It's where you can get your physicals, seek medical treatment. If you have something you need to discuss with the doctor, it's all done down here at Trinity Health. But co-located with Trinity Health is Cardinal Sleep, and that's what we're here today to talk about, is Cardinal Sleep, the relationship of Cardinal Sleep to Prime, what their function is, what they do for you as a driver, what they do for Prime, and that's really the purpose of what we're going to talk about today. And this facility is state-of-the-art, and we're going to go ahead and show it to you. We have an identical facility like this out in Salt Lake City, and though we're somewhat limited for space, we are looking for different options that sometime in the future that we may be able to do in Pittston as well. Our three main terminals, Springfield, Salt Lake City, and Pittston, we want to be able to provide all of our services to you at all three of those locations to make it a little bit more easy for you to access the services that we offer. So today what I want to do is talk about Cardinal Sleep and sleep apnea. Sleep apnea has been around. It's become a challenge within the trucking industry, and we've identified over the last 10 or 15 years that there's a lot of opportunity here for us to help our driver associates by identifying sleep apnea and offering treatment for it. Heather's going to talk to us about exactly what is sleep apnea, but what I know, my basic understanding is it's something that prevents you from getting a good night's sleep. And from a safety perspective, we always want you to have a good night's sleep. That could be the difference between having a good day out on the road and maybe being a little bit irritable, a little bit more short-tempered than you normally are, and we just want you to be focused out there on safety. So a good night's sleep is really important, and that's one of the reasons that we partner with Cardinal Sleep. And what I'd like to do now is bring in Heather, and Heather manages Cardinal Sleep here. A lot of you already know her. She's a wealth of information, and we're fortunate to have you here today, Heather. Thank you.
Hi.
First thing I want to ask you, it's always the #1 question on people's mind, what is sleep apnea?
Sleep apnea is a disorder where it's more of a respiratory disorder that happens while you're sleeping. And there's a couple of different things that can happen. Your airway can collapse completely, or it can partially collapse. And those are the two things that make up sleep apnea. So when the airway completely collapses, that's called an apnea, which is an absence of breathing. And when that happens, it deprives your body of oxygen, which deprives your brain and your organs of oxygen. You're not taking breaths in, so you're not breathing oxygen. And when you deprive your brain of oxygen, it tends to have these little disruptions, and those happen while you're sleeping. So those things are going on. You don't know that they're going on, and so your sleep is a little more detrimental to your health than beneficial to your health.
So you literally stop breathing.
You do. You stop breathing. There are two components that make up obstructive sleep apnea, and the other one is called a hypopnea, and that's basically a decrease in the airflow of breathing, and that can be from the airway being partially collapsed, or it can be from excess weight on the neck, the chest, and the abdomen. The point of a hypopnea is that you're just not getting the amount of air in that you need, so it also causes the oxygen level to drop, which causes the disruptions in the brain because of the lack of oxygen. So the same thing happens, but there are two different types of respiratory events, but they are both in the diagnosis of obstructive sleep apnea. So I think a lot of people get a little confused, and they think, well, I don't stop breathing. No one's ever seen me stop breathing. You can be breathing very shallow, and it can still have the same impact on you as if you completely stopped breathing.
So let me ask you this. Can a doctor just look at me, for example, and tell one way or the other, do I have sleep apnea?
No. A doctor is not going to be able to just look at you and tell you that you have sleep apnea or you don't. You're definitely going to need to have a sleep study. You're definitely going to need to have all the parameters measured that are measured in the diagnosis to find out whether or not you have sleep apnea. It's an overnight study, and there's a lot of information that's gathered, which we can talk about later, but it's definitely not something you can just look at someone or even a partner, tell you that, hey, I watched you sleep last night. That's not going to be a diagnosis. You're going to need to have a sleep study.
That would probably explain then, and we've seen this come up at our safety meetings. We've had different people talk about having sleep apnea, and we've seen some very fit people. Certainly not an ounce of fat on them. They're not overweight, but yet they're diagnosed with sleep apnea. So that does happen.
Yes, definitely, it does. It can be genetic. It can be, due to the physical shape that you are in, and a lot of times people they look like they're in great shape, but, their neck muscles, maybe they have, built up their neck muscles for one reason or another. You were a linebacker in college and you lifted weights. Building up those neck muscles is great if you're a linebacker, but it does tend to narrow the airway. So are there things that you can do that are physically good for one part of the body, but not necessarily good for increasing your risk for sleep apnea?
Okay, that's good information. What I'd like to do next is go to the sleep lab, and maybe we can kind of see what the whole process is, maybe starting with how someone ends up having a sleep study, and then what takes place at the sleep study, and then when the sleep study's concluded, what information is given to the driver, and how do they know with certainty whether they have sleep apnea or not.
That sounds great.
So we've talked about what sleep apnea is, where we're located here on the bottom floor of the Millennium Building. But right now we're in one of the actual rooms where a sleep study is conducted. But before we get to the point where Heather explains what goes on during a sleep study, I want to ask her, Heather, how does a driver get prescribed a sleep study? They can't prescribe it themselves. Someone can't just say, go get a sleep study. What's that whole process where they end up at a sleep study?
Well, if they are symptomatic, then they need to definitely get in touch with their primary care or the DOT physician and let them know that they have things going on, whether it be daytime sleepiness or, just any of the symptoms that might go along with that. Morning headaches, those kind of things. And the DOT physician or their primary care will write them a script for, the sleep study order. If they are just going in for a recertification, or they're going in for their first physical, or whatever that may be, the physician is going to look for things, like their neck circumference, their airway exam, and their BMI. They're going to look for those things if they have type 2 diabetes, if they have high blood pressure, their age. So they're going to take those things into account, and they would be the ones that would write the referral. The DOT physician's not going to be the person that makes the diagnosis by any means, but they are the one that might see a red flag, that says, hey, this is somebody that we need to get tested.
I think that red flag is a great term there, and we talked about this, and you just said it. The doctor or healthcare provider is not going to say, you have sleep apnea. He suspects it or thinks that it may be possible,
right?
But all he's going to do is refer that driver to a sleep study.
Right, definitely. So, a lot of people get really upset sometimes, or they get really nervous or afraid when they get referred. And, I always tell them, it's just a red flag. The best case scenario is you're going to rule it out. And that's, in this line of work, having something ruled out is often as important as, finding out what you have and treating it.
Certainly. So we have a driver. He's gone to get his DOT physical, or he's just come to Prime, and during his initial physical, Dr. Abraham or his staff says, I suspect you might have sleep apnea. So they prescribe a sleep study. Why don't you walk us through what actually happens during a sleep study?
Okay, during a sleep study, we're going to have you come in the evening, and you'll come in during the day and fill out some paperwork that the doctor needs to see, and then you'll come back in the evening. You're going to take a seat, and the technician is going to put a lot of little electrodes on your head that measures your brain waves. It tells us if you are asleep and what stage of sleep you're in. You are going to have a chest belt and an abdomen belt, which is going to measure your chest and abdomen for rise and fall for flow of breathing. You're going to have an oxygen sensor on your finger that's going to measure the oxygen level in your blood. You're going to have a little cannula that measures the pressure from the airway. So you are pretty wired up. You also have EKG leads to measure your heart rate and rhythm. It's cumbersome, but it's not painful or invasive, and that's what I always try to really stress to people. It is a little cumbersome. It's not going to be a perfect night's sleep. But being restless or stressed out is not going to make you test positive for obstructive sleep apnea. Only having those respiratory events when your brain waves show that you're asleep to an extent that the physician feels like you need to be treated is what would make you test positive.
So the sleep study really is, it's a night's sleep that's being monitored medically.
Correct. Yes, that is exactly what it is. I think a lot of people have a misconception that I'm going to go and if I don't sleep like a baby, it's going to be a problem. That's not the case. It's a medical test. It's a study.
I know from information you shared at driver meetings and with new drivers that the monitoring is also fairly high tech. Can you show us exactly what goes on? We've got a driver sleeping here, hopefully getting a good night's sleep, but then all that information that's going outside this room, and there's a technician out there, correct?
Yeah, we'll step right out here and we'll show you one.
Okay, great.
So this is where we would monitor the electrodes and the belts and the other equipment that we use to gain data. This is the place that we would have the sleep study information going to. And we're just going to watch this throughout the night and make notes on it. If there's anything that needs to be corrected, in the room, we're going to go in there and take care of that. But this is where all the information is going to go, and so that we can give that to the physician in the morning.
Now, Heather, it's my understanding that Nathan, for example, he'll only watch 2 drivers. If you have many people having a sleep study at night, you've got multiple people monitoring, so they're seeing exactly what's going on every minute of the night.
Right. Yeah, the technician is only going to have 2 patients at a time.
So you told us earlier that when a driver has a sleep study, he'll be hooked up to some different electrodes. It's non-invasive, it doesn't hurt, but this is obviously sending a lot of information out to Nathan here. What exactly is Nathan looking at?
So it's going to have your brain waves and your brain activity. It's going to have the oxygen levels in your blood. It's going to have your EKG patterns, so your heart rate and rhythm. It's also going to have flow patterns from your breathing. So it gives us a lot of information, and we just make sure that everything is working right and accurate so that we can give that to the physician.
So this is really a blueprint for a night's sleep. It's everything that happened to a driver that night.
Yes.
All right, Heather. So the sleep study's done. Nathan monitored all the data here. It's the morning. What do you do with all that data now?
Okay, so the driver is going to go back to the truck or to the room, and we are going to collectively get all the data together, and we're going to send that to the physician, and he is going to review it and go over it in great detail and provide us with a diagnosis by the end of the day.
And really, there's 2 diagnoses, main ones that are possible. Either the sleep study was negative for sleep apnea. So let's talk about that one. What if the sleep study is negative?
If the sleep study is negative, we're going to have you come back in here, get your results, explain those to you as to what the physician has said, and then send you over to Trinity, and they are going to be able to complete your physical. There's not going to be any cost to you because Prime pays for the entire cost of a negative sleep study.
Okay, good. What if a sleep study was positive? The doctor looked at it, and when you talk about the sleep doctors, these are MDs.
They are. They're boarded in sleep.
Boarded in sleep, so they know what they're doing. They've looked at all the data, and they said, this gentleman or this woman has sleep apnea.
Right.
So what's going to happen next with the driver?
There's a couple of different things that can happen. If they are in a range that they need to be treated, then we're going to have them come back in here, and they are going to have a WebEx consult with the sleep physician that read their study. He will go over the details, or she, and explain those to them, answer any questions, and then we will be able to go ahead and set them up with equipment to treat sleep apnea. There's a range that they could fall in that the doctor might say, you have sleep apnea. It's not to the point that I'm mandating treatment yet, but it is something that I want you to have a little more education about. And so, again, you'll still be called, to come back, but it'll just be a different scenario. And those are the things that we explain in detail, and they also have the opportunity to get a hold of the physician to ask any questions about in that situation as well.
So when the physician's going over that, we're using technology, and the driver can see the doctor on the screen.
Yes.
Driver can ask any questions that he has, what he
Yes.
doesn't understand, and we go from there.
Yes, and the doctor's also going to be providing examples from the sleep study and going over that so that they are going to be able to understand that and see what that is and have it explained to them.
Okay, great. So the driver's completed a sleep study. He's talked to the doctor. Now it's time for him to get what I'll just call CPAP equipment. And you've got quite a bit laid out here. Why don't you kind of walk us through what you have here, Heather?
Okay. After the driver has results and they've talked to the doctor, then we're going to get them set up. This is a PAP machine, and basically PAP stands for positive airway pressure. It can be an APAP, a BiPAP, or a CPAP, but this is what they're going to be dispensed. It comes with a humidifier. Humidification keeps your airway moist while you're sleeping. Definitely something that you want to use if you're going to be using a PAP. The tubing connects to the humidification and to the mask. And there are several different kinds of masks on the market. We have a large variety, but I have 4 out here just to kind of give you an idea of the different types. And this is a full face mask. And full face masks are great if you're on a higher pressure. They're great for people that have allergies and they have some congestion issues. And so they're pretty popular. There's also full face masks that do not touch the bridge of the nose. So if you have issues where you don't like that on your face, or you don't like that part of your face touched, then you have a mask like this. There's a nasal mask, which just covers the nasal area, doesn't cover the mouth. And I would say this one is probably the most popular. It's easy to wear, and it treats the problem. Nasal pillows are another one that's really popular, and very light, very non-invasive, the least amount of material as any of them, and it stretches. So we've got lots of different styles of each one of these, but these are the 4 types that are, primarily carried. And so you have a lot of options, and that's the important thing with a mask, to remember that you want it to be comfortable, you want it to fit, you want to find one that works for you. And the great thing is they all have 30-day exchange policies. So if you get one in the first 30 days that is not working for you, you can exchange it and try something different. We've actually had a driver that I think he exchanged his about 7 times in the first month. But we want to make sure that you get one that works for you, because that makes a difference in using the machine and not using the machine, the way that your mask fits. So that's really important.
So on our brand new drivers that are going to be using that handout, they're actually going to take their sleep study once they get their actual CDL. They'll come back to the yard, test out, and then take their sleep study. Is that correct?
That is correct. So it is a little bit different. And that's where they want to follow the steps to take part in the flyer. And that explains to them what they need to do. So they're going to schedule when they come back in to test out for their CDL.
Okay, we've got that. Let's go back just for a minute about someone that says, I have my own doctor at home, or I want to go through the VA. And you mentioned it can't be a home test. It's got to be I'll call it a real sleep study.
Yes.
But then you have to have a way to monitor that they're actually using it if they're dispensed equipment. Can you talk about that for us?
Sure. And like I said before, it's not mandatory that you use Cardinal Sleep. It's a service that's here on site for your convenience. So if you do choose to go home and have it done through your own provider, that's completely fine. But if you end up on therapy, we need to make sure that we have access to that. And all of the machines nowadays have software programs that when they put them into the software program, they can give us access to be able to view that as well. So, we just need to be able to monitor that and to report it and to make sure that everybody, is doing what they need to do. Also, if you come in and you're already on therapy as a new hire, then we can put your machines into our system and be able to monitor that as well, as long as they are newer models that have the ability to do that. Occasionally some of the older ones are not able to do that, but it's very rare. So if you're coming in on therapy, you don't have to purchase a new machine, but you do have to have one that we're able to monitor.
Good. And when you talk about monitoring, that's where once a week you send to the safety department the compliancy level of all our drivers in the program, so we can ensure that they are staying compliant out on the road.
Yes. And that is, that's reported every week, and so we just want to make sure that everybody's, being taken care of.
Okay, good. Let me ask you this question because it comes up a lot and it's on everyone's mind. A doctor says, I have sleep apnea. What would be the negative of not treating that? What would happen if I said, you know, I'm not going to go with Prime. Prime's going to make me get a sleep study. They're going to prescribe equipment. I'll just go to another trucking company because they're not going to do anything. What's that going to do physically to the body, not treating the sleep apnea?
I mean, the biggest thing you want to think about is your health. It's like any other disease or disorder. You know, with diabetes, you have to treat that. With heart disease, you have to treat that. If you leave obstructive sleep apnea untreated, you are 90% more likely to have a stroke than someone who's treating sleep apnea. You're 76% more likely to have congestive heart failure than someone who is treating sleep apnea. So knowing that you have it and leaving it untreated, your risks are not just 1 to 2% more likely that those things are going to happen. They're really high. High blood pressure, heart disease, stroke, type 2 diabetes. So, you know, there's a wide variety of systems that it affects in the body, and it really increases the risk of those things happening, you know, leaving it untreated.
So treating it, it sounds to me we're making the person, number one, healthier, and hopefully we're extending their life.
Absolutely.
Because they're not going to have the high blood pressure and the other things that you mentioned.
You know, your quality of life is definitely going to be a better situation if you treat it. You know, I tell everybody it's like any other disorder. You know, some things you don't notice that you have. You know, sometimes people have thyroid conditions or you know, issues where they don't realize what's going on, and once they get on treatment, it's completely different. Sleep apnea is a lot like that. Once you treat it, you start to realize that, you know, you didn't feel as good as you thought you did at the time. So I would tell everybody, be open-minded, give it a chance, and take care of yourself.
How about for those folks that say, okay, you prescribed it, I did the sleep study, I'm on therapy. Is there any way or anything I can do to get off therapy?
Definitely the doctor will go over that with you. If you have results through us, you know, if you do your study through us, the doctor's going to touch base on that. You know, 75 to 80% of the people that have obstructive sleep apnea, it's the physiological condition that their body is in right now. So changing that physiological condition can definitely have an impact on, you know, the need to treat sleep apnea. We have had a lot of drivers here that have made some changes that have, you know, decreased the amount of weight on their neck and their chest and their abdomen, and that has made a big difference, and they have, you know, retested and been able to come off therapy. So no, it doesn't necessarily have to be a life sentence at all, but if you are one of those people that the doctor says, you know, hey, this is something you're going to have to learn to love, then definitely for your health I would do that.
Stay on it.
Yeah.
But for that 75 to 80%, maybe tying in with the Prime driver health and fitness program,
Absolutely.
doing that on your own, maybe some sort of exercise regimen, changing your diet a little bit. You know, we could all probably lose a few pounds, but that could potentially lead to coming off of therapy.
It definitely could. It definitely could. And the doctor, like I said, would be able to give you a better idea of exactly what your results say in the situation that you're in. But definitely is, you know, always an encouragement to have people do that, as opposed to, you know, being on something that they don't want to embrace.
Certainly,
you know?
certainly. And it gives everyone a goal.
It does, absolutely.
It does. You know, Heather, I'd like to thank you for being with us today. I hope everyone finds this informative. I just want to tell you a couple of things before we go ahead and wrap up this video. Sleep apnea, the testing, the monitoring of it, it's not going away. Prime has been a leader in this for the last 10 or 15 years. I'll put it in simple terms. It's not a scam. This is really something that affects people's lives. It's critical. What we're seeing is the rest of the industry catching up to Prime. Sometimes we get a question, well, the FMCSA or the DOT, they haven't mandated this. Why is Prime doing this? We're doing it because it's the right thing. It makes you healthier, which makes you safer, and hopefully gives you a longer, more productive life. We've all only got one life, and we talk about this at all our safety meetings. We want you to have the best quality of life possible, and for a lot of people, getting in this program is a life changer for them. I don't want you to be scared of it. Heather and her team are great folks. I've known them all for a long time. They will do whatever they can for you to make this program work. Again, it's not going away. We need to work together with this and make you healthier and safer. I appreciate your time today. If you have any questions, again, Cardinal Sleep is located on the lower level of the Millennium Building. You're also welcome to come up to the safety department on the main floor of the Z Building. We can talk to you about this. It is important. So again, thank you for your time, and we'll talk to you all soon.